multimodality imaging in cardiology is something that now is the present and is also the future for our patient. Our patient has to be studied at best with all the possible imaging modalities, and sometimes you have to fuse more than one of the different modalities. So ultrasound is always the first step to study the patient, but very often the patient has to be scanned with MRI, cardiac MRI or cardiac CT, or also with fusion imaging. This is the moment in which we need to know at best the status of coronary arteries, the status of the myocardium, and the status of valves of any patient with difficult cardiac pathologies. In this occasion, you need to find the right exam for the right patient. And for example, the study with perfusion MRI is very often necessary to know at best the disease of myocardium. And the same is to study coronary arteries. Usually a stress test helps a lot to know the functional status, but you need also the cardiac CT to know the anatomy. So therefore, in conclusion, today the patient has to be studied very deeply with all the multimodality imaging opportunities. So a new opportunity for new patients, for the classical cardiologist.